According to the National Institute of Mental Health, nearly 1 in 5 U.S. adults live with a mental illness. Mental health is a pressing issue in this country with a variety of different disorders, but today I want to discuss two of the most common disorders, which are anxiety disorder and major depressive disorder. Today I will inform you on the reasons that mental health disorders occur, who are most impacted by them, and how these people can recover from and manage their disorders. Imagine you wake up with a heaviness in your chest, persistent thoughts of panic and worry, and difficulty breathing. Or imagine that you are extremely fatigued, feeling disinterested in things that you used to enjoy, and have difficulty getting out of bed because of feelings of unworthiness or guilt. This is just a small glimpse into how people who deal with these disorders experience their lives day to day. According to Healthline.com, to be diagnosed with or considered suffering from major depressive disorder, you must have 5 or more of the symptoms and experience them at least once a day for a period of more than 2 weeks. Similarly, with anxiety disorders, a person may experience some of the symptoms on occasion, but to truly be considered a disorder, these things must occur regularly to the point of interfering with a person's ability to function properly in their daily life. Furthermore, anxiety can come in a variety of different disorders like PTSD, OCD, GAD, or panic disorder, which all carry with them their own set of struggles and symptoms. Neither anxiety disorders or major depressive disorder have one solidified and proven cause for occurring, but there are several factors that have been proven to be at least partly to blame. As reported by Healthline.com, anxiety can be caused by certain traumatic experiences, genetics, or accompany other mental health conditions. Healthline also notes that with major depressive disorder, a combination of genes and stress can affect brain chemistry and reduce the ability to maintain mood stability, meaning that if a person has the genetic predisposition to getting a mental disorder and experiences some kind of environmental trauma or something similar, then that is a perfect storm for developing one of these disorders. Anyone at any time could develop one or multiple mental illnesses, but there are certain aspects that can affect how much more or less likely you are to developing one. The Anxiety and Depression Association of America states that major depressive disorder is more prevalent in women than in men, and that women are twice as likely to be affected as men by generalized anxiety disorder. The National Institute of Mental Health states that young adults aged 18 to 25 years had the highest prevalence of any mental illness compared to adults aged 26 to 49 and age 50 and older, meaning that both gender and age are factors in developing a mental illness, and that many young people and females today are suffering more from these mental disorders. With other aspects of a person's life, such as race or socioeconomic background, they aren't the root of a cause for any mental illness developing, but they can affect your quality of recovery, treatment, and the severity of the symptoms that you experience. The last thing I'd like to speak about today are the types of treatments that can be used to help recover from and manage these conditions. Two of the most common that occur are medication and therapy. With these two types, there are various forms that they can come in depending on what kind of disorder the person has and how severe the symptoms are. When it comes to psychotherapy, a person can get this through many different perspectives, such as behavioral, family therapy, or what's most commonly used today is cognitive behavioral therapy. I personally have undergone that kind of therapy, which uses different methods to attempt to retrain the brain to think in a more fair and realistic way. This seems to be a very helpful form of therapy, at least for me, and provided very good results. With medications, there are several categories, including SSRIs, SNRIs, and benzodiazepines. SSRIs are one of the least side effect ridden psychological drugs, but they don't usually cover all of the spectrum of disorders unless they are given in higher doses. SNRIs are like SSRIs. They are used as a first line of treatment for disorders, but they aren't recommended to be used with OCD. And then benzodiazepines, those are more of a short-term use drug for mental disorders, and if wanted to use for longer use, then they will require higher and higher dosages over time. For those trying to manage their mental disorders, medication, therapy, and the combination of the two can be used to combat it. In conclusion, today I've spoken about the causes and effects of mental disorders, who is most vulnerable to developing them, and what can be done to manage the symptoms. I hope that today my speech has given you a better understanding of the state of mental health in our country and inspires you to be a more open-minded and empathetic person to those struggling around you.